Now I would like to call Dr. Saleha, Aftab, PG Scholar, Department of Molecular, to give a presentation on an open-label randomized controlled clinical study to compare the efficacy and safety of substitute with liquid therapy in patients with uncomplicated dining bugs chronic constipation. Please comment. Thank you, Sindra, for calling me. I Saleha from Department of Molecular, having session 85. Before starting my presentation, I'd like to welcome all the newly joined scholars in this historic college, GTCH, and congratulations on your next step in the academic journey of your life. As you all have already heard various synopsis presentations in the previous days. So today I am here to share and to explain my synopsis for the dissertation. The title of my dissertation is an open-label randomized controlled clinical study to compare the efficacy and safety of salbutamol with the liquid therapy in patients with the uncomplicated chronic constipation, that is diarrhea bugs. So basically, this is my clinical trial. As you all know, clinical trial is a type of research study that tests the medical, surgical, or behavioral interventions in the human participant. This presentation is made under the supervision of Professor Dr. Saleha Aftab and Dr. Muhammad Majidul Rahman sir. I'll share my presentation under these subheadings: introduction, need of the study, review literature, hypothesis, and material and methods. Let us start with introduction. Chronic constipation. It is a frequent health problem causing great discomfort to the person that is rarely associated with the life-threatening diseases, but has a substantial impact on patients' quality of life. Constipation is generally described as having less than 3 bowel movements a week. Patient may also have complaint of straining, sense of incomplete evacuation, and either abdominal bloating or perianal pain. While chronic constipation is described as a common complication determined by difficult or rare passage of stool or both that persists for several weeks or longer. Similarly, the American College of Gastroenterology and the Latin American Consensus on Chronic Constipation define it as a functional disorder with an evolution of at least 3 to 6 months, characterized by infrequent difficulty in passing and long time to achieve deposition. According to our United System of Medicine or literature, constipation, also known as PUBS or PUSL, it is a condition characterized by altered bowel movements, that is, no adequate stool or reduced quantity of stool, which may be dry or hard, and difficulty in defecation. When we talk about its incidence, the worldwide prevalence of constipation in adults has been estimated as 12 to 17%. But the true prevalence of constipation in the larger Indian population is not known due to lack of a uniform definition of constipation. Also, in India, people are often hesitate to talk about their bowel movements, which makes it difficult to collect accurate data about the prevalence of this disease. ये बात आप सभी ने नोटिस किया होगा at the time of the internship in OPD, patients कभी भी आपके पास as it is problem लेके नहीं आता है until और अपने साथ हम से हिस्ट्री कहीं नहीं लगे क्योंकि लोगों को बहुत अजीब लगता है बाउल मूवमेंट के बारे में बात करना और कहीं ना कहीं ये बहुत बड़ी वजह है कि हमारा एग्जैक्ट एक्यूरेट डेटा डिजीज को लेके नहीं मिल सकता है बट हमारे यूनानी सिस्टम ऑफ मेडिसिन में इसकी इंपॉर्टेंस की बात करें तो इसको उम्मुल अमराज में रखा गया है व्हिच मींस मदर ऑफ ऑल डिजीजेस फॉर एग्जांपल अगर मैं कोई भी स्किन डिजीज लेती हूँ तो सबसे पहला सबक आप उसूल इलाज में देखेंगे पहला जो जुमला है वो यही है कब्ज को रफा करें फॉर एग्जांपल हेयर फॉल वो एक्ने वल्गैरिस हो बहुत सारे ऐसे अंदाज हैं बहुत हैरत की बात है कि जब मैं रिसर्च का सोचना शुरू की मुझे एक भी रिव्यू पेपर और आर्टिकल नहीं मिल सका मतलब इन आवर सिस्टम ऑफ यूनानी मेडिसिन अब तक इस पे कोई रिसर्च हुआ ही नहीं है हालांकि मॉडर्न वाले इसको सिर्फ एज अ सिम्टम लेते हैं लेकिन उनके फील्ड में बहुत सारे पेपर्स हैं तो कहीं ना कहीं बहुत बड़ा फैक्टर था इस टॉपिक को सेलेक्ट करने के लिए इफ वी टॉक अबाउट इट्स etiology causes of constipation are multifactorial like a lack of fibrous diet, inadequate fluid intake, lack of physical activity, means sedentary lifestyle, certain medication like iron and calcium supplements, several metabolic disorder like diabetes mellitus and hypothyroidism, other factors like psychological, in which anxiety and depression included. Likewise, constipation has various causes outlined in the different Unani literature. Excessive consumption of fatty, oily, and heavy, which means suffering foods, coupled with minimal intake of roughage and green vegetables. It can reduce gut peristaltic movement. It results in constipation. Other factors such as consumption of quicklime and hard butter, it can also reduce the peristaltic movement of gut and causes constipation. But in most cases of chronic constipation, no specific cause is found. Its clinical features are less than 3 bowel movements a week, straining and defecation, sensation of incomplete evacuation, abdominal bloating, hard or lumpy stools, sensation of anorectal obstruction. Let's talk about need for the study. No doubt there are countless laxative drugs in the market because this problem of constipation is not new. It is as old as the mankind. But the main issue is currently available pharmaceutical formulation of laxative, enemas, purgatives have very limited safety window and adverse effects such as nausea, flatulence, dehydration, cramps, and abdominal pain. If we talk about its major disadvantages being faced after the prolonged use of like deficiency of fat-soluble vitamins, fluid and electrolyte imbalance, hypokalemia, malabsorption syndrome, hepatotoxicity, and renal insufficiency, etc. Therefore, the search for alternative therapy is very important nowadays, which should be relatively safe and efficacious. So it can be used in long-term treatment. In this context, use of a herbal medicine, suppose is a goal, as an alternative to synthetic drugs in the management of uncomplicated chronic constipation. It will be a precious contribution to the healthcare system. It is reported in a survey by WHO that about 88% of the world population rely on medicines of plant origin for their primary health care. As the literature, the drug isabgol, a Basidium patuna, as you all are aware about drug isabgol, also known as Basidium patuna, botanically named as Plantago ovata, belongs to the family Plantageneaceae, cultivated for their seed herbs used in pharmaceutical industry. It contains natural colloidal mucilage, which forms gelatinous mass by absorbing water. It relieves intestinal dryness and it acts as a mild laxative when it is taken with water. Keeping in view the above discussion, it has been planned to conduct a randomized, open-label, controlled clinical study to evaluate the efficacy and safety of an Unani combination sabuz in the management of uncomplicated chronic constipation, along with comparing it with the liquid paraffin. Liquid paraffin, also known as mineral oil, it is a viscous liquid, a mixture of petroleum hydrocarbons, being used as a laxative since 19th century. It is a fecal lubricant and a stool softener as it retards water absorption from the stool. Let's talk about review literature. In 1868 AD, Hakim Ajmal Khan, as mentioned in his book Hazir, that either passage of stool on second or third day or passage of reduced quantity of stool is constipation, which may be due to weakening of poor diarrhea, which is expelling force as a result of excess of bulgur, and various other factors, including indigestion of suffering pizza and irregular bile, sulfur flow into the intestine. In Vyasi, he further emphasizes that constipation is more prevalent among the individuals engaged in the mental work, as the extensive use of the brain begins in nerve. This nerve weakness in turn affects the nervous system of the gut and it reduces peristaltic movement. Also, it's a common observation that some individuals with cold stool during the pressure to pass it, ultimately it leads to habitual constipation. Hakim Hasan Parshi in Jami al-Hikmat elaborates that irregular passage of reduced and dried stool on the straining is termed as chronic constipation that is contributed by 3 factors: First, nostalgia, that is excessive use of fatty and fried diet, lack of fibrous diet. Reduced peristalsis, that is sitting for prolonged duration, excessive mental work, general body weakness, melancholia, nerve weakness, and postponing defecation, etc. Last, reduced bile or intestinal juices due to zofe jigar or jigar ka soye misaj bile. In 10th century, according to Majusi in his book Kamil Sana, delayed stool passage can be attributed due to the weakness of Kuvate Dafya and an excessive strengthening of Kuvate Masa, that is the tentative force, or presence of weak sensation in the intestine. This delay may also result from inadequate food, means or consumption of constipated foods, that is Habis Baza. In 20th century, as per Hakim Kabiruddin in Al-Aqsi, constipation may be because of heart and Yabis results of intestine or excessive accumulation of flatlets. If we talk about aims and objective of the study, what do you understand by objective of this study? It's a specific target to accomplish your aim. And these are my primary objectives: to determine the efficacy and safety of Sabusi support and liquid therapy in the patients of uncomplicated chronic constipation, to compare the result of test drug, which is Sabusi support, with controlled drug, liquid paraffin, in respect of safety and efficacy in the management of chronic constipation, and to provide a safe and efficacious drug from a herbal source for the management of uncomplicated chronic constipation. Secondary objective is to provide improved quality of life to the patient. Hypothesis of my research study that Sabuzabul has an equal or nearly same therapeutic properties with the liquid paraffin in the management of uncomplicated chronic constipation. इस स्टडी के जरिए मैं Sabuzabul को ये शो नहीं करना चाह रही कि लिक्विड पैराफिन से ज्यादा अच्छा है या फिर इससे कम साइड इफेक्ट्स है। इनकम इस तरह की कंपैरेटिव स्टडी में जो मैंने लेके चला है वो है कि लिक्विड पैराफिन का सेम थेरेपेटिक प्रॉपर्टीज है एज अ होल का भी, नॉट मोर इफेक्टिव, नथिंग लाइक दैट। इट्स जस्ट अ माय hypothesis is nearly same therapeutic properties. Source of data from patients visiting OPD or RCT in Government Degree College and Hospital, Patna. Method of collection of data. Patients attending GTCH OPD will be included in this clinical study through this retesting and after qualifying the inclusion or exclusion criteria. My inclusion criteria are patients between 20 to 60 years of age, patients of either gender, patients having the complaint of abdominal pain or discomfort, reduced bowel movements that is less than per week, or infrequent stools, sense of incomplete evacuation, nausea, pain and defecation, straining and defecation, and flatulence. Also, patients willing to stand written informed consent to participate in this trial. Exclusion criteria are below 20 years and above 60 years of patient, pregnant and lactating women, patients taking other drugs such as AOP and opium group, also anti-acid medicine which has aluminum or calcium because it leads to chronic constipation. Associated complications like diabetes mellitus, hypertension, hyperthyroidism, anal fissure, hemorrhoids, hernia, anal abscess, etc. Patients with chronic debilitating disease or neurologic abnormalities. Also, one by previous surgery of the colon and having diagnosed intestinal structure abnormality. Patients with phlegmatic temperament, mentally retarded person or prisoners, non-ambulatory or bedridden patients. Patients who is not able to give consent. Now, withdrawal criteria. What do you understand by withdrawal criteria? Under which a participant is discontinued or removed from a study before its completion. These criteria are basically for to ensure the safety of participants and to maintain the integrity of the study. My withdrawal criteria are patient who develops some complication like anal fissure, hemorrhoids, etc. during this study. It is acute systemic illness during the therapy if the subject not willing to continue, non-compliant with the study protocol, and patients who fails to follow up. Subjective parameters. Subjective parameters are क्या समझते हैं? क्या समझते हैं?
Subject कैसा हो? Content management.
Maybe this question is quite important here.
सब्जेक्टिव पैरामीटर जो पेशेंट को सेलेक्ट कर रहे हैं वो कैसा हो उसके लिए
These are the parameters which patient tells about his problem, about his state. Like patient will come and say, "उसे fever है," तो ये subjective parameter है बताया. इसको आप quantify नहीं कर सकते हो. It can't be measurable. But the objective parameters you can't measure. The numerical form objective parameter जो हम physician जो है observe करेंगे वो किसी भी parameter से अगर patient ने फीवर बताया वो फीवर कितना है हम पैरामीटर्स चेक करेंगे ड्यूरेशन की चेंज के स्टेट में करते हैं जस्ट लाइक पेन पेशेंट फॉर एग्जांपल लाइक माय सब्जेक्टिव पैरामीटर्स एज एब्डोमिनल पेन पेशेंट विल कम एंड टेल मी एब्डोमिनल पेन अब पेन कितने रेशियो में आता है स्केलिंग होगा आपको समझ आने चाहिए किस स्केलिंग पे आता है 1 2 3 तो दैट आर ऑब्जेक्टिव पैरामीटर्स जो हम लोग ऑब्जर्व करेंगे और जो पेशेंट खुद बताएगा वो सब्जेक्टिव पैरामीटर है व्हिच कैन बी क्वांटिफाइड. So these are my subjective parameters. Presence of any one of the clinical features along with the objective as follows. Abdominal pain or discomfort, reduced bowel movements or infrequent stools, sense of incomplete evacuation, nausea, pain at defecation, straining at defecation, flatulence. And my objective parameters are for evaluating of clinical efficacy, stool frequency and stool consistency. For the And for the diagnosis purpose, there is a named criteria, known diagnostic criteria. This criteria is established by Rome in 1991 under the following parameters, that is less than 3 bowel movements per week, lumpy or hard stools, straining during defecation, sensation of incomplete evacuation or anorectal obstruction or blockage, manual maneuver. Example, digital evacuation, support of the pelvic floor. For diagnosis purpose, minimum any 2 parameters should be present during the period of 3 months and having been started at least 6 months before diagnosis. Study design. Study design of my research is an open-label, randomized, controlled clinical trial. Open-label से आपको क्या समझते हैं? It is a type of clinical trial under which both participants or investigators knows about the treatment, what patient has given to the treatment. Basically, it's like a transparency provide करता है because everyone knows about the interventions and what about randomized controlled trial. ये भी clinical trial का एक हिस्सा है जिसको gold standard माना जाता है for evaluating the efficacy of any drug. हम basically randomization करते हैं, patient को group में divide करते हैं. एक group हमारा होता है experimental group, एक होता है control group. एक्सपेरिमेंटल ग्रुप को हम अपना टेस्ट कर देते हैं जो कि मेरा सब गोल है और कंट्रोल ग्रुप को लिक्विड पैराफिन देंगे फिर इन दोनों में कंपेयर करेंगे. कंट्रोल ग्रुप बेसिकली प्रोवाइड्स अ बेस टाइम फॉर कंपैरिजन. This basically helps researchers to assess the drug effectiveness by comparing outcomes between these two groups. Sample size of my research study is 60, 30 in each group, as I told you, 30 in each group. Experimental group and next 30 is test group. Duration of the protocol therapy is 6 weeks and duration of the study is 12 to 18 months. Sorry? Follow-up. First follow-up at the end of second week, second follow-up at the end of 4th week, third follow-up at the end of 6th week. What is the procedure of my study? As I told you, right now, patients of uncomplicated chronic constipation who fulfill my all inclusion criteria will be enrolled in this study. 60 patients will be included in this study. After making them understand of this study and obtaining their voluntary informed written consent, they will be allocated randomly in 2 groups. As I told you, randomization, हम लोग randomly select करते हैं, randomly allocate करते हैं. A and B for the test group and the control group respectively. In this study, the test drug sabuzabol and the control drug liquid paraffin will be given to group A and group B respectively for 6 weeks to the patients with uncomplicated chronic constipation. And they will be asked to keep a record of frequency of bowel movement and stool consistency. Informed consent. Patients fulfilling the inclusion criteria mentioned above will be given the information sheet having details regarding the nature of the study and drug to be used. Patients will be given enough time to go through the study. Details mentioned in the information sheet. They will be given an opportunity to ask any question And if they agree to participate in the study, they will be asked to sign the informed consent form. Interventions for tests. Medications will be administered orally as supposed to support adequate paraffin suspension. Now, method of uses of my drug. All the patients will be divided into two groups, Group A and Group B. Each group has 30 patients. Group A will be given supposed support 12 grams soaked in plain water prior to 30 minutes of administration to form mucilage in a single dose at bedtime. And the Group B will be given syrup liquid paraffin 15 ml single dose at bedtime. यहाँ पे एक क्वेश्चन बनता है, मैंने प्लेन वाटर मेंशन किया है, मैंने आपको लिखो अच्छा बोल का दो एक्शन होता है, एज अ लैक्सेटिव एज अ स्ट्रेचर. यहाँ पे प्लेन वाटर मेंशन का मतलब ये है कि ये लैक्सेटिव स्ट्रेचर में कब कन्वर्ट होता है जब हम उसको हीट प्रोवाइड करते हैं. पेशेंट को मैं बोलता हूँ कि आप गुनगुने पानी में, जैसे कि बुक में लिखा है गर्म पानी में या गुनगुने पानी में आप ऐसे बोलते हो इसको खोलो, बट हमें क्या पता अगर कहीं को ज्यादा गर्म पानी में अगर उसने सोक कर लिया तो स्ट्रेचर कॉज करेगा, इतना रिजल्ट एक्यूरेट नहीं आएगा. दैट्स व्हाई आई मेंशन. अब मेनली म्यूसिलेज का एक्शन है एज अ लैक्सेटिव, तो उसको प्रायर टू 30 मिनट्स लेने से पहले, क्योंकि 30 मिनट्स इज एनफ टू फॉर्म म्यूसिलेज, तो इसलिए हम पेशेंट को यहाँ पे प्लेन वाटर में दे रहे हैं, ना कि नहीं गर्म पानी और गुनगुने पानी में. Along with these drugs, high fiber diet should be recommended. Investigations for exclusion, random blood sugar, hemogram, thyroid profile, and for the safety evaluation, liver function test and renal function test. Assessment of the efficacy. Patients' bowel habits before each treatment will be compared with those recorded during the second, fourth, and last 6 week of the treatment. An effective treatment will be considered as clearance of impaction, that is more than 3 bowel movements per week, and improvement in stool consistency. Now, assessment of safety, all adverse events such as diarrhea, abdominal colicky pain, etc. Experienced by the patient or observed by the investigator will be recorded at each visit. Adverse drug reactions will be assessed on Naranjo-ADR probability scale, as Dr. Vipo ma'am has explained before lunch, these ADR probability scale, and also on the accelerating classification. Adverse effect recommendations. Any adverse drug reaction due to use of above medications will be recorded as well as reported to Adverse Drug Reaction Monitoring Center and will be analyzed using Naranjo scale. Assessment of MISAJ according to Ajna se Ashra. Documentation. This record will be submitted to the department after completion of the study. Statistical analysis. All analysis will be done using appropriate statistical tests. Does my study require any investigations or interventions to be conducted on patients or humans? My answer is yes. These are my references. Any questions?